Hello, my name is Kayla Chapman, and I am here to demo your tracheostomy suctioning and care checkoff. So of course you are going to show your badge, and I have reviewed my physician's order and gathered my supplies. And for my supplies, I'm gonna need a pulse ox to monitor my patient's oxygen, my stethoscope, my sterile water, my suction catheter kit, along with my tracheostomy care kit. So I am going to knock on the door. Hello, my name is Kayla. I'm going to be your nurse today. Can you confirm your name and date of birth? Okay, patient confirms name and date of birth. Do you have any allergies? No. Okay, I'm going to provide privacy. I'm going to go ahead and do hand hygiene. I'm going to let my patient know that the doctor has ordered for the patient to be suctioned and for me to provide trach care. Is that okay with you? Patient states it's okay. I'm going to go ahead and put my patient in a comfortable position. So that's going to be me raising the bed. And I am going to go ahead and lower the side rail. So I am going to go ahead and auscultate my patient's lungs, and I'm going to do this with 8 points anteriorly as well as posteriorly. This is also going to be under the gown, so I'm going to do 2 on the top upper lobe. I'm going to let my patient know I'm going to go under their gown and do 2 in the mid lobe, the lower lobes, and then 1 on each side. Okay. So now I'm going to go ahead and apply my patient's pulse ox so I can monitor their oxygen. And at this point, this is when I would hyperoxygenate my patient per the physician order. So whatever your physician has prescribed, that's what you would alter your oxygen, increase your oxygen to. So now I'm gonna go ahead and connect my tubing to the suction canister, turn my vacuum on, and I am going to occlude the end of it into the tubing to make sure my levels are within 80 to 120. And I'm gonna put it here while I'll be able to reach it with one hand. So now I'm gonna go ahead and prepare to suction my patient. So I'm gonna open this up here. I'm gonna grab my sterile basin, making sure that at no point I touch the inside of it. I'm gonna put it here. Now I'm gonna grab my sterile water, and of course my cap is gonna be face up. And now I'm gonna pour my just a little bit of sterile water into the sterile basin. I'm gonna move that here. Now I'm ready to open up my sterile field. So I'm gonna don my first glove, and of course I'm gonna grab it and step back. Grab this and step back. And now I'm gonna grab my suction tubing, or my suction catheter. I'm gonna twirl it here in one hand so I can have full control over it. Now this is gonna be the hand that I choose to contaminate. And so I am going to grab this connection tubing and connect it to my catheter. And now I'm gonna test and make sure my suction is working properly. And with having to do that, my thumb is gonna have to be on the valve. So my suction is working properly. Now I'm ready to suction my patient. So with my non-dominant or dirty hand, I am gonna move my patient's trach mass over to the side, and I'm going to begin to suction the patient. And I am inserting this catheter until I either feel resistance or my patient coughs. And so now I'm going to withdraw this catheter, and my thumb is going to be over the suction valve. And I am going to, again, replace my patient's trach mass with my non-dominant contaminated hand. So I am going to assess for color, odor, consistency, and I'm also going to monitor and assess my patient's oxygen. And so now I'm ready to clear out the line, clear out the catheter here, okay? And I'm also going to allow my patient at least 30 seconds to recover. So now I'm ready for my second pass. I'm going to remove their oxygen there, and I'm gonna do the same thing. I'm gonna insert until I feel resistance and or the patient coughs. And as I'm withdrawing, my hand is on the suction, my thumb is on the suction valve, and I'm gonna replace my patient's oxygen. Now I am done with suctioning the patient. My patient's oxygen looks good. At this point, I can go ahead and choose to lower my patient's oxygen back down to whatever the baseline was, and I can turn off this vacuum, and I'm gonna go ahead and clean up my supplies. So my sterile water will still be there. Now I'm ready to perform trach care. So I am going to do hand hygiene, and I'm going to start with opening my kit. And of course, it's always gonna be away from you. I'm gonna grab my drape, step back. I'm grabbing it from the 1-inch border, and I'm gonna make sure my shiny side is down. I'm gonna walk in, place my drape down here. I'm not over my kit. Okay, now I'm going to don my sterile gloves. Step back. And here, and so even with me grabbing this other glove here, I am making sure I'm not crossing over my sterile drape. Okay, and so now I'm going to remove all of my items in my sterile kit, and I'm going to put it onto my drape. And now is the best time to go ahead and organize everything and separate it while both of my hands are sterile. And again, I'm making sure that I'm not over my drape at all. I'm kind of still standing back here and separating everything that I need. And I'm also making sure that none of my items are on my 1-inch border. So now I'm gonna begin with the actual trach care. So with my dirty, non-dominant hand, I am going to move the trach mass over. I'm gonna grab my patient's inner cannula, and I'm gonna replace the trach mass. So now I'm ready to rinse, and I'm gonna rinse my inner cannula in the biggest compartment of my trach care kit. I'm gonna grab my brush, I'm gonna step back so I'm not over my sterile field, and I'm going to clean the outside of the cannula. I can put it here, or if you have a trash can that you have placed right by your bedside table, you can dispose of your items there as well. I'm gonna grab one of my pipe cleaners and clean the inside. Now I'm going to rinse my inner cannula in a separate compartment that I have not used. I'm gonna rinse it, and I'm gonna grab a dry gauze and dry the outside of it. Get rid of it here, and then I'm gonna grab my last pipe cleaner, step back, and dry the inside of it. So now I have cleaned my inner cannula. I'm going to move my patient's trach mask over, and then I am going to insert it back. And I know that it's inserted once I hear a click. So I hear a click, I'm gonna replace the trach mask back. And at this point, my sterile procedure is over, but I am still gonna wanna use standard precautions. So I'm gonna grab one of my Q-tips, or my cotton swabs, and I am going to dip it in the sterile compartment that I have not used, the water. I'm gonna moisten it. I'm gonna remove this over, remove the patient's previous split gauze that's already there, and again, assess for coca. And now I'm going to clean the patient's stoma in a circular motion, and I'm also gonna be assessing the stoma as well. Once I've cleaned in a circular motion, I am going to use this cotton swab to clean under their faceplate. Okay, so I'm gonna go ahead and get rid of that. And then I am going to grab a dry gauze. I'm going to moisten it. Now I am going to clean the patient's front plate. Okay, and then now I'm gonna grab this last dry gauze, and I'm going to start off with drying the stoma first and under the faceplate. And then I'm going to, with the same gauze, dry the front of the faceplate. Okay, get rid of it. Now I can grab this split gauze here and replace it. So I'm gonna kind of fold it in half and feed it through. And I'm gonna replace my patient's oxygen. Now, lastly, I am going to replace my patient's trach tie. And you can, again, remove the patient's trach mask in order to do so. So I'm gonna feed it through. Make sure it's even. Wrap it around here. And I am not able to remove the old trach tie until the new one is placed and secured. So now I'm gonna tie this. Now I am able to remove the patient's old trach tie. Okay. So at this point, I am going to, of course, make sure my patient's trach mask is back in place. I'm going to cover them back up. I can assess and make sure that their oxygen saturation is within normal range. And I'm going to go ahead and auscultate their lungs again. And I'm gonna again do this 8 points anteriorly and posteriorly. And you are able to just verbalize that you will auscultate your patient's breath sounds posteriorly. Side. Okay, I'm gonna cover the patient up. Your lungs sound good, they're nice and clear. I'm going to raise the side rail, lower the bed, make sure my patient has the call light. I'm gonna go ahead and gather all my supplies. I'm gonna remove my gloves. Provide hand hygiene. And now I'm ready to document. And what I wanna make sure that I document is that I provided trach care to the patient. I also did suctioning. And I am also going to document any assessment of drainage, odor, that the patient may have had around their stoma and or their galls. And that will complete my checkout.